Welcome, everyone. Today, we're diving into the fascinating world of blood pressure. So, what exactly is blood pressure and its physiological factors? Blood pressure is the force of blood pushing against the walls of arteries as it flows through them. We measure blood pressure using two numbers, systolic and diastolic. Blood pressure is measured in millimeters of mercury, mmHg, and a normal blood pressure reading is typically around 120/80 mmHg. Maintaining a healthy blood pressure is crucial for overall health. High blood pressure, or hypertension, can strain the heart and blood vessels, leading to serious health complications such as heart disease, stroke, and kidney disease. However, the good news is that lifestyle changes like regular exercise, eating a balanced diet low in sodium and saturated fats, maintaining a healthy weight, reducing stress, and limiting alcohol and tobacco use can help manage and even prevent high blood pressure. In today's hectic world, stress seems to be an inevitable part of our daily lives. But did you know that stress can affect more than just our mood? It can have a significant impact on our physiological health, particularly on our blood pressure. Imagine a typical day at work, deadlines looming, emails flooding in, and tensions rising. This constant state of stress triggers the release of hormones like adrenaline and cortisol, which can cause our blood vessels to constrict, leading to an increase in blood pressure. But stress isn't the only psychological factor that can affect blood pressure. Our emotions also play a crucial role. During moments of intense anger or frustration, our bodies enter a fight or flight response, causing a surge in blood pressure as our heart rate increases. On the other hand, techniques like mindfulness meditation have been shown to reduce stress and promote relaxation, which can have a positive effect on blood pressure. Regular physical activity is another important factor in maintaining healthy blood pressure levels. Exercise not only helps to reduce stress but also strengthens the heart and improves blood circulation, and let's not forget about the importance of sleep. Chronic sleep deprivation can lead to increased blood pressure and a higher risk of hypertension. So, whether it's managing stress, practicing relaxation techniques, staying active, or getting enough sleep, taking care of our psychological well-being is essential for maintaining healthy blood pressure levels. Now let us talk about the diseases it causes. High blood pressure, hypertension, doesn't directly cause diseases, but it can significantly increase the risk of various health conditions, including heart disease, stroke, kidney disease, and other cardiovascular problems. Here's a detailed explanation of how high blood pressure can cause health problems. 1. Cardiovascular disease. Persistent high blood pressure can damage the arteries throughout the body. This damage makes the arteries less elastic and more prone to narrowing, atherosclerosis, which restricts blood flow. When the arteries supplying blood to the heart muscle, coronary arteries, become narrowed or blocked, it can lead to coronary artery disease, angina, chest pain, heart attack, or heart failure. 2. Stroke. High blood pressure can cause damage to the blood vessels in the brain. This damage can lead to the formation of blood clots or the bursting of weakened blood vessels, hemorrhagic stroke. Both scenarios can result in a stroke, which can cause permanent brain damage, paralysis, or even death. 3. Kidney disease. The kidneys play a crucial role in regulating blood pressure by controlling the balance of fluids and salts in the body. However, hypertension can damage the blood vessels in the kidneys, impairing their ability to function properly. Over time, this can lead to chronic kidney disease or kidney failure, requiring dialysis or kidney transplantation. 4. Peripheral artery disease, PAD. High blood pressure can also damage blood vessels in the legs and arms, leading to peripheral artery disease. PAD causes reduced blood flow to the extremities, resulting in symptoms such as leg pain, cramping, numbness, and poor wound healing. In severe cases, PAD can lead to tissue damage and amputation. 5. Aneurysms. Persistent high blood pressure can weaken the walls of blood vessels, causing them to bulge or develop aneurysms. Aneurysms can occur in various arteries, including the aorta, the main artery carrying blood from the heart. If an aneurysm ruptures, it can lead to life-threatening internal bleeding. 6. Vision problems. Hypertension can affect the blood vessels in the eyes, leading to retinopathy, damage to the retina. Retinopathy can cause vision problems, including blurred vision, double vision, or even blindness if left untreated. 7. Metabolic syndrome and diabetes. Hypertension is often associated with other risk factors for cardiovascular disease, such as obesity, high cholesterol, and insulin resistance. Collectively, these risk factors contribute to metabolic syndrome and increase the risk of developing type 2 diabetes. Overall, high blood pressure is a significant risk factor for a wide range of health conditions, and controlling blood pressure through lifestyle changes, medication, and regular monitoring is essential for preventing these complications.